Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab. All on your time, live or on demand. This is CSIS Online. Welcome to CSIS Online. The way we bring you events is changing, but we'll still present live analysis and award-winning digital media from our Dracopolis Ideas Lab. All on your time, live or on demand. This is CSIS Online.
Good morning. My name is Judd Devermont. I am the director of the Africa program at the Center for Strategic and International Studies. And it is my honor to host this very special conversation today with former Finance Minister and MDC Vice President Tendai Biti of Zimbabwe, ACT Party Leader Zito Kabwe of Tanzania, and UPND President Hakainde Hichilema, also known as HH, of Zambia. Our goal today is to unpack what it means to be an opposition leader during a pandemic. How does one's fight for democracy intersect with a fight for public health? And we're going to ask our distinguished speakers some very difficult questions about the challenges and trade-offs they face. How do they interact with government to constructively shape the response to the pandemic? How do they respond to public bans and curbs on media that are done ostensibly to address the public health crisis? How do you ensure that your country emerges from this pandemic in good health, in better economic shape, and as stronger as a democracy? And finally, what should the international community be doing to fight both for public health and for democracy? Now, these are very difficult questions, and I'm very fortunate that we have an expert to moderate this session. Salam Solomon of VOA is going to handle the moderated discussion, and then we will have an opportunity later on to take your questions from the audience. All you have to do is turn to our website, csis.org, to the event page, and there's an opportunity to submit a question, which we will ask of our distinguished panelists. Just one final statement before we start, or one final caveat. We are broadcasting from Washington, D.C., from Lusaka, Zambia, from Harare, Zimbabwe, from Dar es Salaam, Tanzania. So bear with us if there's any issues around the quality of the transmission. We'll do our best, but we are trying to be very global today. So with that, Salam, let me hand it off to you.
Well, that was great. Thank you so much, and thanks for the introduction, Judd. Welcome to everyone watching us from around the globe. This is a vitally important topic and very impressive panel from countries that are going through major transformations. So let's dive in. Around the world, countries are putting in place unprecedented restrictions on freedom of movement, civil liberties, in response to the coronavirus global pandemic, and elections have been postponed, public gatherings forbidden, lockdowns are strictly enforced, all in the name of public safety and health. So, but are there any cases where these restrictions can be used by those in power to consolidate power? And will some of these restrictions stay in place beyond the virus's threat? These are the ideas that we're going to be exploring today. We'd like to dig into these questions and more with the political figures that we have who are experiencing it firsthand and are on the front lines of democracy. So I'll start with Mr. Tendai Biti of Zimbabwe. I'd like to start with you, Mr. Biti. On June 5, just recently, you led a group of MDC Alliance party members who tried to take back the party offices in Harare from security forces. And you were arrested, just as we were discussing, and spent days in custody. At the time, there were also a ban on gatherings, including those of political protests. So can you describe what has it been like to try and operate as a political opposition leader during the COVID crisis?
And I think you are on mute.
Yes, thank you very much for organizing this chat and team, and good afternoon to HH, good afternoon to Zito. Well, look, countries like Zimbabwe, Zambia, Tanzania, Mozambique, DRC, and many others on the African continent, we had a pandemic before. Before Corona, we had a pandemic. And that pandemic was a dictatorship. That pandemic was authoritarianism. And this pandemic, this political pandemic, is had a bonus in the form of the coronavirus pandemic. So the coronavirus pandemic is coming as a bonus to aid and abet the quest for authoritarian consolidation. And the coronavirus has been used to justify the imposition of a de facto state of emergency in countries such as Zimbabwe and Zambia. And in the case of Zimbabwe in particular, we've had these draconian regulations that were enacted in March of 2020 and have been amended on more than 30 times, which have simply served to lock down democracy. So while it's the ruling party and the first lady, the first family are able to go around their business, we in the opposition, we in the Movement for Democratic Change Alliance, led by Nelson Chamisa, were not allowed to carry out or do any activity. But not only that, the pandemic has also been used as a vehicle of massive corruption and looting. So we've had a situation where massive tenders have been flighted and abused, massive donations have been given to the country and abused. As I'm talking to you right now, the Minister of Health has been fired for corruption and is standing charges together with the other officials. So in a nutshell, we are suffering from three pandemics. Number one is the political pandemic, whose curve needs flattening. Number two is the disease pandemic, the coronavirus pandemic, whose curve needs flattening. Number three, there's an economic and social pandemic. In the case of Zimbabwe, 95% of our people are unemployed. In the case of Zimbabwe, we are experiencing inflation or hyperinflation of 1,400%, the second highest in the world after Venezuela. We are facing massive shortages of power, of fuel, of basic foodstuffs. So we've got, where many countries have got one pandemic that needs flattening, we have three pandemics that need flattening. And the biggest one of those is the political pandemic, the governance pandemic, the rule of law pandemic. And that's the status quo that we are going through.
I mean, this is an important segue, and all these ideas are interconnected, the health structure, political structures. And so just taking away from what you just said, Mr. BT, I would like to throw this question to Zito Kabwe of Tanzania. Leadership in times of pandemic is very important, and the president of Tanzania, John Magufuli, has been one of the most vocal skeptics of the prevalence of the coronavirus and the accepted scientific wisdom on how to control it. We've heard so many rhetoric coming out of political discussions on this issue. Has there been freedom among the political class to push back against this rhetoric? That's what we haven't seen. And so if there has been, if you can tell us about that, and how are average citizens or journalists being able to express themselves in Tanzania? Do people feel at liberty to speak up?
Thank you very much. First of all, you have explained it very well. The response by the president of Tanzania and the government of Tanzania has been skeptic, denier. They denied at once the existence of a pandemic, but also they made sure that they control everything. They control the media reporting on the pandemic. They even controlled the social media conversations about the pandemic. A number of people were arrested for posting information about their loved ones passing on, dying out of the pandemic. Another problem and a big challenge we have in Tanzania is on the statistics, the data. The government immediately blocked any information or any data to be published regarding the cases, the deaths, the recoveries. So with that, it is very difficult in a country like Tanzania even to know to what extent that pandemic has affected the people. Lastly, it is the economy. As many of you know, a third of our foreign exchange come from tourism. And tourism was the first culprit sector following the COVID-19 pandemic. And the government response to that was so underwhelming because the government continued implementing the policies as if the pandemic doesn't exist. A number of people who have lost jobs in the tourism sector alone is above 500,000 people. And this is only for Zanzibar and the Northern Circuit in Tanzania. Last 2 weeks ago, 3 weeks ago, I was in the southern part of the country where the major crop apart from cashew is the sesame seeds. They were receiving more than $1 per kilo of sesame seeds they were selling before the pandemic. And after the pandemic, the prices have gone down to 40 cents of $1 a kilo. And this has affected the lives of the people, and the government has completely ignored. So coming to your question whether the political opposition or the media or the civil society is free, we're not. We're not free at all. We are not allowed to comment on anything. We are, of course, the government is using the WHO guidelines saying only the Minister of Finance will speak about it and use it to completely suppress the opposite views. But also even the professional associations are not speaking at all, and they're not free at all. So it has, as far as Tanzania is concerned, this thing has gone so well with the autocratic nature of our President John Magufuli.
Well, thank you so much for that explanation, and we'll come back to that idea that you talked about, flow of freedom of information. But since you mentioned the economy, it's very integral, very important. I'd like to throw the third question to Mr. Hakainde Hichilema of Zambia, especially because, like what Zimbabwe, tonight Mr. BT was saying, the three categories, the economy, health, politics, but the economy is also integral because Zambia was facing a debt crisis way before COVID and the global economic shutdown has made it much more worse, not just to Zambia, but globally. And so as of April, Zambia's external debt was estimated at $11.2 billion, with half of that owed to foreign powers like China. So in terms of debt service payments, taking up the country's tax revenue, how concerned are you, Mr. Hichilema, about Zambia's, being forced to make drastic concessions to outside actors and major policy changes to address a debt crisis that's looming in your country? Hello?
In the US, I was just saying that I'm grateful that we are on the program today with honorable colleagues in the States, Tendai Biti, and obviously Zito. Thank you very much for giving us this opportunity, the three of us, and of course the many listeners that are listening to us this time. The debt issue in our country is real. It's actually a very sad situation that our country finds itself in a debt crisis yet again, especially after having qualified for HIPIC. Most of you may remember what was called the Highly Indebted Poor Countries Initiative. And that was achieved at great pain to the people of Zambia. Workers didn't have salaries increased for a long time so as to contribute towards achieving the debt relief. shortly afterwards, we are now in a worse debt situation, orchestrated basically by a government that didn't understand what debt means and how and why should debt be acquired and what you do with it. So we have the numbers that you're talking about, the $11.3 billion is not really the true numbers, because there's, first and foremost, there's no proper full disclosure of the debt position, because we lost control, this government has lost control of the debt acquisition process, where the Treasury in the past was responsible, by and large, to acquire debt. Now you have ministries, departments that have been accruing debt directly without the Treasury being aware. And that's one of the fundamental problems we've had to really pin down as to what the extent of the debt. When you add external plus domestic debt, we're close to $20 billion. That's not a joke for a small economy of $27 billion in terms of GDP. So we're in a very difficult situation. And the important thing to say here is that debt was acquired, one, in a reckless manner, one, two, at a high cost, three, it was not applied in areas that will help grow the economy to generate revenue. That's the third problem. So now we're in a situation where the debt acquisition was a conduit, a platform to raise money to be stolen through corruption, and therefore creates a situation where the economy was growing at 7% when PF took over office in 2011, and well before COVID, the economy declined to under 2% before COVID-19. I think it's a point that I needed to make so that the panel and the listeners are aware, because the COVID-19 situation has been used as an excuse, as a reason why the economy has declined, why the debt has, if you like, increased exponentially. We already were in a very difficult situation because of poor management long before COVID. That is extremely important to us, showing that the economy will decline by another minus 5.5%, basically meaning wiping out any growth that was there before the COVID-19 situation. So we are taking up about 40% of domestic revenues are going to debt service alone. And then when you add public sector pay, ticket, another substantial amount, 50% thereabout. So you're left literally with 10% thereabout to invest in education, and now you have COVID. So we have a situation where before COVID came, the health sector was already stressed because it was not receiving enough money to support the basic health service provision to our people. It's a very difficult situation. You have 10% of the revenue available, obviously, to invest in education, in agriculture, to feed our people, in the industry. The resultant effect is that before COVID-19, we already had no jobs for the youth. We had no decent health services. We had no capacity in the agriculture sector to feed ourselves, despite our huge potential in this part of Africa. I mean, literally everything is there for us, but we are failing to exploit these opportunities. So debt is crippling us. Debt was acquired as a conduit into projects such as road construction, high cost, low quality roads. A road that should cost us, for example, one road that should cost us around $400 million, Lusaka and Dola Road, it's costing us $1.2 billion. Now, $800 million is gone through the window. Borrowed money, not to create, but to be taken away, to be stolen through corruption. So the COVID-19 situation has, thank you.
All right, thank you so much for that in-depth explanation about how the economy is suffering as a result of also governance issues. Just to give everyone an understanding, we've reached out to all the governments in the 3 countries, and we've actually heard back from the government of Zimbabwe about responses. When you're saying there's corruption, when you're saying there's lack of governance, there's someone to be held accountable for these actions you're talking about, the economy, the health infrastructure, and all of these political issues that are intertwined. I'll turn to Zimbabwe, Mr. Biti. We heard back from the Zimbabwean government, and their response was very elaborate. As the government said they were quick to respond to this pandemic swiftly. They reached out to available resources from donations coming from different parts of the world. And so, as someone who's spent a little bit of time in some sort of power and leadership, 5 years, the little pushback for you would be, how do you see yourself or your opposition party to positively contribute to progress in terms of the things that we're talking about, ensuring accountability, ensuring average citizens are not tied in this cycle of poverty?
Yes, thank you. Look, you speak about the response of the Zimbabwean government to COVID, the disease, and then, of course, our role. We are very critical of the manner in which the regime in Harare has handled the pandemic. To contain the disease, there has to be a number of things that have to be done at a clinical level. The first one is, of course, the issue of testing, the issue of contact tracing, isolation, the provision of PPE, personal protective equipment to frontline workers. In this regard, the response of the regime has been, a disaster. Up until the end of June of 2020, we had done less than 60,000 tests. And as I'm talking to you right now, we have only done around 98,000 tests, of which more than half of those are the rapid tests and not the diagnostic tests. So the fear right now is that we have a lot of local infection and local transmission. The fear right now is that a lot of people are actually dying, but because we are not testing, we are not able to, give the exact and to capture the exact data. And without data, you don't have the platform to make informed decisions. You are not able to determine whether you're on this side of the curve or on that side of the curve. Your response becomes anecdotal. Your response becomes motivated by other factors, not the disease. And in the case of Zimbabwe, those other factors are just authoritarianism and the power retention agenda. Another criticism of the way that they've handled, or more appropriately mishandled, the disease is the failure to give social safety nets to communities. As I said before, 95% of our people are unemployed. 79% of Zimbabweans are living in extreme poverty, surviving on less than US 35 cents a day. So to combat the disease, there was an obligation on the government of handing out cash payouts, of providing basic foodstuffs to communities in the townships and in the rural areas. That has not happened. There's also been a failure to provide a stimulus package to industry, to businesses, particularly small to medium enterprises that have been affected by the pandemic. So we're very critical. We have cooperated with government in parliament. We chair the health parliamentary portfolio committee on health in parliament, led by Dr. Ruth Labode, who is a member of the MDC Alliance. And we have provided a paper in which we have said to the government, it's so critical that you provide resources that can offer resilience to our people. Number two, it's so critical that you are transparent as far as the procurement is concerned, and that you follow the country's procurement laws. Number three, it's so critical that you protect the frontline workers, particularly the hospitals, so the doctors and the nurses. As I'm talking to you right now, nurses are on strikes, junior doctors on strike, senior doctors have just given notice of intention to go on strike. So in the middle of the pandemic, the frontline workers have been abused and they've withheld their labor. Number four, provide the hardware to combat the disease in the form of quarantine centers, in the form of isolation centers, in the form of hospitals that can deal with the disease. That again has not been forthcoming. So as a result, we've had private players that have had to come on board at exorbitant prices that our people can't afford. And to many elites in ZANU-PF, this has been an opportunity for actually looting. Where people are dying, this is an opportunity for people to make money, and that is regrettable. Which is why I said at the beginning, the true solution to Zimbabwe's crisis is addressing the leadership crisis, addressing the political crisis. Anything else and everything else is a waste of time, because we have a government that is totally irresponsible, a government that is totally incompetent, a government that is totally clueless, and a government that is driven by two things alone: the power retention agenda and, of course, patronage and corruption. And I guess that is the story in Mozambique, that is the story in many other African countries.
Well, let me push back a little bit when you said, we have strikes coming up in the middle of a pandemic, right? And so in terms of attest to your leadership in the opposition, there's a scheduled protest just coming July 31st, including members of the opposition. So unions, civil society are planning to attend. The government is saying that, they've warned it will not be permitted. So how do you expect it to go as planned? Do you expect it to go as planned? And also, what about the risk of the pandemic during this time in terms of assembly?
Well, I think that if you put the pandemic, the disease, in the context of every other crisis that we have, it pales into insignificance. So just to give you the statistics, up until yesterday, we have 1,362 infections, and we've got 23 deaths. So we've got 23 deaths since March. Now compare that to the number of people that are already dying of cholera. Compare that to the number of people that are already dying of dysentery. Compare that to the number of people that are already dying of hunger. Compare that to the number of people that are dying of HIV/AIDS. So COVID pales into insignificance. It's not even the top 10 of what is killing our people. So people are protesting, and people are going to protest against the bigger diseases that they are facing, which existed long before COVID. What are those bigger diseases? The political disease, the disease of stealing elections, the disease of stealing resources, the disease of misgovernance, the disease of abuse of the rule of law. So there will be protests, but there will also be deaths. As you know, the Zimbabwean government is very ruthless and very violent. On the 1st of August 2018, 8 people were shot in cold blood by the military. In January of 2019, 19 people were shot in cold blood. There have been hundreds of abductions. Recently, 3 young girls belonging to the MDC Alliance were arrested, abducted, sexually abused. That's the day-to-day story of Zimbabwe. So people will protest because they have no other resource or a safety valve, and that's going to happen.
So there's an attack on other broader issues, and it's all relative is what you're saying. And I would like to come back to Tanzania to just touch on the civil liberties that you mentioned. Earlier, I think we talked about civil liberties, free speech. You mentioned that people have been arrested for speaking up. Most notably, there's recent the Media Services Act that passed in 2016 that makes it basically a crime to what they say is write or print seditious content. From your perspective, what kind of effect has this law or legal arm by the government has been used by the government in response to COVID? Are people still afraid to speak up in Tanzania? What's the environment like from your work? Mr. Kabwe, can you hear me? Can you hear me?
Maybe we should go to a question for HH and come back to Zito.
Okay.
Sure.
I mean, these are civil liberties are across all of these countries an issue of prevalence. So for Zambia, we haven't really touched on. Yes, we touched on the economy. We haven't touched on the status of how this pandemic has been handled by the government. And so, if you can tell us how the government in Zambia is not only handling, but you earlier mentioned about the economy and the numbers are questionable. So what is it like in terms of information on the spread of the pandemic, how the government is handling it, how the people are aware of the dangers that come with the pandemic? Thank you.
Yeah, thank you very much. I think the starting point is that there was a lukewarm approach or response to the onset of the COVID-19 pandemic in the beginning. There was very clear opportunities that presented themselves for us as a country to manage the COVID pandemic much better. But we lost those opportunities, number one, because the government did not actually act quickly. The time we had 16 cases only, we could have done much better in terms of educating our people on social distancing. We didn't do much. Or avoiding crowds, we didn't do much. On indeed managing our entry at air, land, and water transport. We did not, despite opposition and many other voices alerting the government that they needed to do a managed lockdown early, they didn't do it. And essentially, they allowed a window of opportunity, so to say, for the pandemic to gain roots, to gain momentum. And we've seen that in the numbers now. Basically, we have had a quite what one may call slow uptake. Not because it was truly slow, but because the testing capabilities are very limited. Because the appetite by government to do what was right was limited. Their priority was the ways they've been doing things before, such as oppressing the opposition, taking away the freedom of assembly, association, freedom of expression, not just the opposition now, but to civil society and to the youth movement, who are not allowed to express themselves. Yet the ruling party cadres, and here's the point that is very important, the ruling party cadres can do what they want, including demonstrating at will, without any notification to the police, therefore creating crowds and opportunities for basically spreading the coronavirus, in our country.
But
for quite a long period, even as late as.
I'm sorry to
yes,
cut you, but what has your party, what kind of actions have you taken to make sure that these incidents are avoided?
Well, first and foremost, we advocated for the whole society, the whole country, as a party, to respect the health guidelines, preventive measures that are all known by now, by everybody. But despite our voices and the voices of many other organizations in our country, the ruling party, including my colleague who is in State House, continued behaving as though there was no COVID, encouraging his party members to assemble, to behave in loud ways, as though there was no COVID-19 at all, despite our voices. That's number one. Number two, our party took the lead in encouraging citizens to support the measures that the health authorities have put in place to prevent or reduce the COVID-19 infections, including making donations. We were in the lead in doing that. What are these donations? Such as, of course, sanitizers, face masks, feeding people in quarantine centers, which were poorly managed, I must say. We did encourage the government to respect those guidelines, those measures. They did not. Yet they are the ones who are supposed to have been in the lead in encouraging citizens to respect these guidelines. As a consequence of that, we now have numbers that are increasing at a very fast rate. We have, as of today, 108 deaths, confirmed deaths. But I can tell you that there are many more deaths that are not recorded as COVID because there hasn't been testing. So how would we know? People are now beginning to drop dead and taken to hospitals as BIDs, brought in death. We have infections now sitting at 2,620. And I want to say to you, the projections are not looking good because by August, we are talking about probably 900 deaths. We are talking about thousands more of infections and the situation will get there. And yet, despite our insistence that resources must be allocated properly, moved away from consumption expenditure areas, such as corruption, such as all of the areas we talked about, the government is not doing what the population is expecting it to do in order to save lives, to protect lives. They continue to act as though there's no coronavirus. I'll give you an example. One minister, Minister of Health, has been indicted, has been arrested for corruption. And whenever he goes to court, including yesterday, only yesterday, he takes his party thugs in great numbers and overruns the magistrate's court. The whole court complex is overrun by cadres. They don't respect any health guidelines, no face masks, no social distancing. This is the Minister of Health who on the previous day was advising citizens to respect COVID-19 guidelines. What is going on? We say things, we guide, they're not listening. Their job is to simply work to oppress people, to abuse the Public Order Act. We have a law in Zambia called the Public Order Act, which is applied in a very, very unfair manner, unbalanced manner. So they don't respect all these measures, yet they're preaching to citizens to respect these measures. Our voices are being drowned out, and they're overtaken by the desire to continue to stay in office, even when they failed completely to run the country. As you can see from unemployment numbers, very, very low levels of employment. You can see from health service delivery standards and basic frontline medicines are not there. If you like, oxygen capacity to basically provide oxygen support to those who need it, especially in the last 10, 15 days, is really a crisis here. And the leadership is not there to use resources and allocate resources in the most needed areas, in the most optimal areas. We say, we talk, no one is hearing. It's a crisis of leadership.
So surely there are challenges and accountability as you're elaborating here, and also there's some sort of connection with the three countries. I don't know if you still have Mr. Kabwe. Do we have Tanzania back or? Okay, so I think there are some sort of parallels in all these countries, and the bigger question is obviously you're facing challenges and operating in your home country. Are there any country collaboration between the three of you or beyond regionally, especially if there are some parallels in the way you are facing challenges? what kind of cross-country collaborations do you have, if any, if you want? Mr. BT, you can jump in, or Mr. Hachilema, talking about cross-country collaboration so far.
Well, there is cross-country collaboration for the ruling elite, the old boys clubs. So they have a network in SADC, the Southern African Development Cooperation. They also have a network in the African Union. And if you look at the Southern African region, it has become a very toxic region. It has become a very poisoned region in which we have seen in the past few years massive authoritarian consolidation in Zambia, for instance, in Zimbabwe, in the Democratic Republic of Congo, in Mozambique, and of course, in Tanzania. There have also been rumblings, as you know, even in normally mundane places like Botswana. Compare that with the West African bloc, for instance. So one of the things that we've been trying to do as people in the opposition is to try and have an alternative forum, an alternative association of political parties. HHZ, Zito is here. The MDC Alliance is here. So we've been trying to form something together with the brothers in South Africa. But of course, the greater solidarity is required amongst the people, you know, the Association of Trade Unions, civic society, and so forth. A lot of work still needs to be done, but that's the way to go. We have to form a coalition against authoritarianism in the region. We have to form a people-driven alliance against authoritarian consolidation in the region. And this is important because we are paying a price, we are paying a cost, and we are carrying a burden arising from illegitimacy, dictatorship, and authoritarianism.
I mean, this is also feeds into the way the pandemic is spreading cross-border. I mean, we have porous borders in these countries. It's very tied, as we said throughout our discussion. All of these themes are tied, interconnected. Mr. Hachilema, what do you think cross-country collaboration looks like? I would like you to address that first. But I think I'd like to throw this bigger question to all of you. What do you think the role and the support you expect from either the international community or the U.S. should look like, and what kind of cooperation, would that look like even beyond the regions in terms of the global conversation? Thank you.
Yeah, I think Tendai covered it well in terms of I wouldn't say the old boys club, I would call it a club of oppressors, really. That is working well against the people, against democracy, against human rights, liberties and freedoms, working and learning from each other ways of manipulating elections and not having truly free and fair elections. We see common trends, negative as they are, across our countries in this region in particular. I think Tendai mentioned, and I like that, West Africa is doing much better in providing collaboration for democracy enhancement, for rule of law, for human rights. And we in our part of the Africa are actually doing extremely badly in that area. The largest area of collaboration is the negative ones. How to oppress citizens. Basically, which types of police vehicles they need, which can basically scatter peaceful demonstrations. And we see that every now and then, rather than saying, which type of hospitals, what type of healthcare systems, delivery systems do countries in the region need to invest in order to reduce the cost of looking after our people who need medical attention, instead of them going to India, going to the US, going to the UK. Really, for me, for us, and I think for Tendai, for others and Zito in the region, even though we are not in office yet, we beginning to talk about how can we review our health systems across borders that can take care of the needy people in terms of normal health needs, but more important when with pandemics like this. It's not happening by governments in our countries. I think we in the opposition are clearly seeing opportunities that we can begin to address, to plan to common vision, if you like, for lack of a better word, to address these issues properly. The whole issues of border management, there's no common understanding on how our people, many of whom, by the way, for the colleagues in America and the listeners, many of our people don't have physical borders. They don't have restrictions. They just cross from one country to another. And really, when you have a pandemic like this, collaboration across country boundaries, where there's no physical restraint, there's no screening, for example. Let's be specific. There's no screening. There is no quarantining. Because you can't have quarantining even in our own countries. I'll give you an example. I have a son who came into the country because his university closed. And he was tested at the airport at entry. No follow-up whatsoever. No follow-up whatsoever. Although we quarantined him for 21 days as a family. But where is the follow-ups? Where is the tracking? It's not there. Now, if it's happening like that in Zambia, we should be saying what is going on in Zimbabwe, because we have a lot of common border areas where there's no control. What's happening in Malawi? What's happening in Tanzania? This disease can wipe us out. I mean, can take too many lives, yet they can be prevented. I think for us in the opposition, we're beginning to look at these opportunities of collaboration arising from the failures of those in government today in our countries, those in leadership today, because they have no interest in the welfare of the people, to be honest. I mean, if you look at one fact, for example, in our country, we have a constitution that provides for intra-party elections. UPND is supposed to have intra-party elections. Even though we fulfill the COVID requirements, COVID guidelines, COVID-19 requirements, we are not allowed to have intra-party elections, but they are gathering in big numbers. Why wouldn't they agree within the country, across the region, how to respect minimum guidelines, minimum requirements? I think we in the opposition, Tendai, Zito, and others who may be listening, we have a great opportunity to manage our countries differently when our time in office comes, but obviously better. When I say different, I don't mean worse or less better, but much, much better through collaborating and learning to do it, working to do it now before we form government. Because those in office have failed the countries, our countries, have failed our citizens. It's evident, it's very clear.
I see. I mean, we're getting a lot of audience questions, and I think everyone is on the same page about what kind of actions you'll be taking. Even, especially now we have upcoming elections. I think Judd can jump in here to raise the questions coming our way from audience, and most of them are about the upcoming election and what kind of steps you'll be taking. And so, Judd, you want to jump in to ask the questions?
First of Tendai, and just for our audience to know that we are working on trying to get Zito Kabwe back on the call, so we hope that he'll join us before the hour runs out. But Tendai, I'm going to ask you a question from the audience and then a question of my own. The question from the audience is fairly technical around whether or not they should amend the NSSA so that there would be funds to mitigate workplace hazards about contracting COVID-19. And you may want to broaden it to what kind of legislation do you think needs to be in place. But my specific question is, since the COVID-19 pandemic, the outbreak, the African Union, particularly AU Chair Cyril Ramaphosa, has talked about lifting sanctions again on Zimbabwe. And I'd like to get your response to whether or not that's a good idea around sanctions on Zimbabwe in light of.
Yeah, so the first question. We need social safety nets in Zimbabwe. And as I said before, these safety nets must be addressed at mitigating the lives of the working people in Zimbabwe who are not in formal employment anyway. And as you may know, the informal sector is in fact closed and shut down by the authorities. So women can't sell vegetables in their markets cross-border traders can't go to Zambia, can't go to South Africa, can't go to Mozambique, can't go to Tanzania to buy and sell wares. So given that, for these people to survive, it's so important that the government provide safety nets in the form of cash handouts and food. The NSSA he talks about is the National Social Security Authority. So he's making the suggestion that the Social Security Authority must pay out. I'm not concerned about the source of money because NASA does have huge resources. I'm not concerned about the source. I'm concerned about demand side supply. There must be money that will go to these communities until such time as the pandemic has been flattened. This is so important to mitigate the lives of our people. You ask about sanctions on Zimbabwe. There is a lot of abuse about that word, the word sanction. Zimbabwe has trade relations with every country, including China, including the United States of America, including the United Kingdom, including South Africa. It's so important for Zimbabwe to get its act together. It's so important that Zimbabwe adjusts its behavior so that we become a full member of the international community that enjoys the same rights and respect as any other country in the international community. But we have to earn that right. We will earn that right if we respect our constitution, if there is constitutionalism, if there is the rule of law. We have to stop stealing elections, raping women, abducting citizens, capturing institutions, and of course, sending out our military to deal with citizens. So if Zimbabwe is concerned about its external relations, it must address its internal relations first. It must address its own relations with its own citizens. And that is the way to go. That is the way to go. That way, any other country, whether it's the United States of America, whether it's China, whether it's Zambia, whether it's South Africa, they will treat us like an equal member. So at the present moment, we can't expect the world to dialogue with us when we can't dialogue with our own citizens. When we dialogue with our own citizens using the baton stick, using tear gas, using water cannons, raping women, abducting citizens, it won't work, and it hasn't worked. Zimbabwe must restore the social contract, respect its citizens. That way it will earn the respect of the international community and its colleagues in the region, in the African continent, and indeed in the international community.
Thank you, Tendai. I believe Zito is back with us, and so I want to ask a question.
I'm so sorry for the internet connection. I'm sorry.
No, we're happy to have you back.
For the host, yeah, thank you.
Well, I want to ask you, sir, about the elections coming up. In your country, you have elections in October. You've already been arrested, and many of your colleagues, you're on bail. So if you could talk a little about the elections, and I hope for our audience, you could talk about the big announcement about Bernard Membe joining ACT and what that means for your party.
Thank you very much. First of all, I'd like to respond to the earlier question. I'm sorry for bringing you back regarding whether people feel free in this environment. In Tanzania, since 2015, with the Cyber Crimes Act and the Media Services Act being passed, but as well as other laws that were enacted by Parliament. For example, the Political Parties Bill, the changes in the NGO laws, all of them have made the fundamental freedoms in this country, especially freedom of expression and freedom of the press, to be in a total danger. So Tanzanians are not free to speak up. Even if your relative has died of COVID-19, you are not even allowed to cry about it. The data is not coming out. The government has a total control in that. So we have a double. So we have the pandemic, but as well as a total 100% oppression on fundamental freedoms. And yes, less than 100 days have remained towards the election. We have a big problem on the whether we are going to have a free and fair election, because the Electoral Commission is not independent at all. The commissioners of the Electoral Commission are still appointed by the president, who is the chairperson of the ruling party, CCM. The bureaucrats of the Electoral Commission are CCM cadres openly. Some of them even went through CCM nominations, primaries in the last election. But we have decided to participate in these elections with all these kind of challenges, because we don't want to give them a chance. We have seen what boycotting election means. We boycotted the elections, the repeat of the elections in Zanzibar after the illegal annulment of the results there in 2015. We boycotted the civic elections that were called in November, where 99% of our candidates were removed from the ballot papers by the CCM bureaucrats. So, and we boycotted them and nothing has happened. So we have decided that we will participate. We'll take mitigation measures to make sure that our candidates are on the ballot. And we know that we'll have a big problem with international observer missions. We are in touch with the Commonwealth. We have written to the European Union. We have written to SADC. We have written to the African Union. We have written to the East African community. But also we are inspired by the citizens and civil society monitoring of the elections done in Malawi, so that we see how this can be done in Tanzania as well, in order to make sure that we at least have semblance of a free and fair election. As you said, we are very happy. We announced to the international media the day before yesterday, and yesterday we presented Mr. Membe, former foreign minister, who served as the foreign minister under President Kikwete's regime for 9 years and 2 months. And he has a wide experience in the region, in the Great Lake region. He has participated in the processes in Zimbabwe and other parts of the Great Lakes region and the SADC region. And we are expecting to use his experiences and his network to put pressure on Tanzanian regime in order to stop this movement towards autocracy. And I always tell my friends Tendai and HH that in Tanzania we are going to these elections with a very big threat towards the very existence of democracy itself, because we might have, after November 25th, Tanzania that is back to single party rule. So our fight is just not a fight for the election. It is a fight to defend our democracy, to make sure that Tanzania continues to be a multi-party democracy. And we need a lot of support from our friends who have already gone through the elections. HH is going to the next election in 2021. We expect him to lend his experience to us. Tendai, we are already in touch, and he has already advised us on a number of things to do. But we are very happy that we have received Mr. Membe as a former foreign minister, and we might have a big boost on the international arena to make sure that Tanzania has free, fair, and credible elections.
Well, you know, this is a dialogue with your constituents as well, and we've got a great question coming from the ground. We're getting from all the countries that we're talking about. And so, Mr. Zito, Idris Lamar from University of Dar es Salaam is saying, how has ACT ensured the safety of its constituents during the COVID pandemic, while recognizing that a lockdown is not financially viable?
Can you repeat that? I did not hear the question properly. From Idris.
How has ACT ensured the safety of its constituents during this pandemic, while recognizing that a lockdown is not financially viable?
Yes, what we have done is, one, we have engaged in, they called BCC, Behavior Change Communication. to educate people about the pandemic, but also in constituencies. For example, in my constituencies of Kigoma Urban, we provided all what is needed to the people on hand washing, explaining to them on social distancing and the like. But as you know, the way our people work, it's very difficult to have the social distancing as it is in the Western world. And we are trying so much to educate our people. The problem we have is that the government doesn't believe on the existence of the pandemic. So the communication from the state, from the head of state, was completely conflicting. While the medical professionals are saying, observe no congregations, reduce going to churches and mosques and the likes. And the president was attending churches and telling people, go to church, no problem. The pandemic will not get a person who, COVID will not get or affect a person who is going to church or mosque or something like that. So it is very hard to operate in Tanzanian environment, but we're trying. We are working hard at the grassroots level, communicating with our people, providing all the proper health expertise needed. We, as a party, we formed a national task force on the COVID-19 response in order to make sure that we communicate with our members as well on how to take care of themselves. But as Tendai said, we're not doing testing in Tanzania, and it's like the testing has stopped. We really don't know how much the community infection is now. We just hear everyday names of people we know dying out of the COVID-19 pandemic. But what are we going to do? The government has decided to be in denial, and that's it.
I want to thank you, HH, Tendai. I wish we had another hour. I had lots more questions. The audience had endless amounts of questions, but I think this is an important conversation to raise awareness about the challenges that you face and that your country faced during this pandemic and in the fight for democracy. We are so fortunate to have your busy time. We are extremely excited that Salim agreed to moderate this and do it so well. And we look forward to more conversations about democracy, about COVID-19, about the economic situation in Africa, and I hope you'll join us. Thank you.
Thank you so much. Thank you so much.
Thank you very much.